Let's get started.
All right, great. So first off, good afternoon. Thanks everyone for coming. Special thanks to Dr. Teckie and Deborah Gruber, who are kind of our guests today. This is the kind of inaugural episode, first episode we're going to do of Corona and the Brain.
River walk, that's not too busy. So we have like a pretty view.
And basically what we're going to do is make this a weekly conversation that we can have, providing support and guidance and resources to the brain tumor and neuro-oncology community. So my name is Randy D'Amico. I'm a neurosurgeon here at Lenox Hill. I'm the director of neurosurgery at a hospital called Wyckoff Medical Center in Brooklyn. And I've got a few guests with me today. I'll let everyone introduce themselves. Let me start with Dr. Teckie.
Yeah, I'm Dr. Sewit Teckie. I'm a radiation oncologist at Lenox Hill Hospital. I work closely with Randy and Debbie, Dr. Gruber.
Dr. Gruber, why don't you go next?
Sure. So my name is Dr. Debbie Gruber. I'm a neuro-oncologist, and so I specialize in the treatment of tumors that begin in the brain, but also in neurological problems that may arise in people who have other types of cancer. And looking forward to participating today.
Great. And Dr. Bookbar, you want to jump in?
Hold on, I got to call you back.
No problem. I'll introduce him for him. John Bookbar is the vice chair here at Lenox Hill Neurosurgery. Is a brain tumor specialist, and he'll be kind of chiming in and out, I guess, through the conversation. Before we get started, just kind of a brief kind of idea of, why we're doing this. And obviously, the coronavirus, COVID-19 has really changed kind of how we're all practicing medicine for the near future, certainly. And it's really unclear for how long that's going to be going on. And, whether the hospitals are preparing for a surge or experiencing a surge, everything's different. Elective surgeries are canceled. There's delays in clinic visits, and, people have a lot of anxieties and uncertainty about this. And so as a community, we wanted to kind of come together as physicians and make sure that everyone felt that their needs were being met, their questions answered, and specific to the neuro-oncology community. And so, every week we'll have different guests and kind of allow everyone to kind of have a conversation and try to answer everyone's questions in real time. So a few rules. First, it's a conversation, but everyone is muted except for the people who I said are not. But basically, if you want to talk, there's a chat function at the bottom of the screen. You can ask questions through that. I'll try to answer everyone's question. And if it doesn't get answered this time, we'll answer it next time. Second thing is, obviously, this is not a reason not to get seen by a doctor. If you're experiencing new neurologic symptoms or worsening symptoms of something you have, you should call your doctor first of all, or go to an emergency room. Just because COVID-19 is happening, just because hospitals are experiencing a surge, doesn't mean that we're not treating people with other diseases. And so it's very important that you communicate with your doctors. And so we'll open it up to questions, but in the meantime, we can, while people ask some stuff, we'll let Dr. Teckie, Dr. Gruber, or Dr. Bookbar, just chime in on what's been going on in their practice, what they've been seeing.
Sure. Yes. Yeah. So our practice is in Manhattan, and obviously for many weeks now, we've had to adjust to the new reality of COVID. So what we've done with our patients coming into the office is we've offered them all telehealth, video, and phone call conversations instead of coming to the office. And that way we can determine if they need radiation. And if they do need radiation treatment, then we bring them in for the treatment steps. We've also implemented a few policies in terms of all staff have to wear surgical masks. Patients are offered surgical masks if they'd like. We recommend that patients do not have more than one visitor with them at a time, and many of them are actually coming alone because they've decided that it's not worth putting their family members at any risk coming to the hospital. And we're just giving people an opportunity to continue their treatment, but with appropriate social distancing. So we're trying to separate patients' treatment times by at least 10 or 15 minutes so that there's no situation where two patients are waiting in the waiting room at the same time. So they're all kind of on their own when they're waiting to go into the radiation machine or waiting to see the doctor. So we're all just really taking this very seriously because obviously we want all our cancer patients to keep getting their cancer treatment, and we don't want anyone to feel like they're putting themselves or their family in harm's way in order to keep getting their treatment.
Yeah, Dr. Gruber, anything to add?
Well, we're pretty much doing the same thing. We're trying to, as much as we can, do telemedicine to reduce visits both for patients and to keep the staff healthy. We're not stopping treatments if patients are on chemotherapies or other medications that they receive in the outpatient setting. Those are all continued. And, you know, just like you said, I think you made a good point that even though this virus is out there and getting a lot of medical attention, life goes on and people have other medical problems that are important as well. And so trying to make sure that that gets taken care of as well, but safely.
Yeah, absolutely. Yeah, so I think the summary is the same as everywhere else, which is that, you know, doctors who aren't taking care of COVID or who are, but also take care of other issues are making sure that their patients who come in are safe. People take this very seriously.
Yeah.
I think one question that comes up a lot is, are there limitations? I know Dr. Teckie kind of touched on this a little bit, but to your office visits, when people come in, should they not bring someone with them? Should they have a health aide call in? Should they be alone?
Well, I think that what we do is serious enough that we always let one person come in with them for, especially if it's a new visit or a visit where they're having some information given to them, say MRI reading. So, I mean, I think that deserves to have a companion with them. I do know that in the infusion room, they're not allowing visitors to accompany the patient, but they're making sure that everybody feels safe and secure. And the infusions are not typically long infusions.
Yeah. What do you guys, I think, you know, the big question, and I think the news tried to answer this a few times, but are patients suffering from brain tumors or spinal cord tumors intrinsically at a higher risk of the coronavirus?
Not necessarily. I mean, I think if somebody is immunosuppressed, but either because they've been on, you know, high dose steroids for prolonged periods of time, or if they had a strong reaction to chemotherapy. Remember, many of the drugs that we give nowadays don't typically cause the counts to drop in a significant way, right? Mm-hmm. So it's not that people are so susceptible, unlike other types of cancer where the chemotherapy can really, you know, wipe out the bone marrow. However, if a patient, we don't want our patients to get infected, because if they do get infected, then there's going to be a break in their treatment, and the break could be of a sort of significant duration, at least 2 weeks. So for that reason, we really want to keep people as healthy and protected as possible. You know, we're all talking about social distancing. No one likes it, but it's really the safest thing right now.
Yeah, Dr. Teckie, anything to add from the radiation standpoint? Is there any risk of immunosuppression that might increase your risk for those patients?
Yeah, it's a really good question, because radiation in itself doesn't make somebody immunosuppressed, but there are some studies that show that the white blood cells count can decrease over a course of radiation because of the blood flow that's being exposed to radiation therapy. I don't think it's in any way meaningful enough to make somebody more susceptible to COVID. And I think if you have a brain tumor or a spinal tumor that requires treatment, that's really the priority. And then you have to take all the right precautions for COVID, but you're not like at a more increased risk just because you have that condition or because you're getting radiation or chemotherapy.
Yeah. And so, I mean, I don't know if we've gone over them at length enough. I'm sure we're going to go over them 100 times more. But those precautions, what would you recommend people do?
What I would recommend people do, and Dr. Gruber, please chime in, is everything that's been advised by all the public authorities. So social distancing, which doesn't just mean keeping 6 feet away from people. It means as much as possible just staying at home, because anytime you're going out, you're exposing yourself to somebody who could be infected. So staying at home, and then if you are forced to go out to get treatment or to see your doctor, then really practicing social distancing, which means staying at a distance from people, washing your hands and or using alcohol-based hand sanitizer very frequently. Wearing a surgical mask, I think now should be standard practice for everyone, not just healthcare workers. Anyone who leaves their home should be wearing a mask. And then also be paying attention to things you touch, like your handbag and your phone and your AirPods and your wallet and your money. Like those are all ways to carry viruses into your home. And I think that's also something else that should probably be disinfected before you get into your house.
Yeah, absolutely. I think, I think that touches on all the key points, right? Wearing a face mask, which is, I think at this point, highly recommended by everyone, even a cloth mask. It doesn't need to be, an N95 surgical mask that you fell off the truck somehow or something. But avoiding social gatherings, washing your hands, being extremely vigilant about what you're touching, especially, if you are a patient going through chemotherapy or radiation or, suffering from some sort of oncologic disease, not just brain tumors. Staying at home as much as possible, making sure you touch base with your doctor and having, a long supply of medications. So you're not, having to call or, be worried you have to run to the pharmacy. Really staying off public transit as much as possible. No cruise ships, right? Cruise ships, bad idea.
If you ever thought of taking a cruise, now is not the time.
Yeah, not the time. And then, you want to, I think, check with your doctor's office. At least what I've been telling my patients is, if you got a question, call in. Don't be worried. A lot of people, listen, there are a lot of docs on the front line who are going out there and, and taking care of these patients. They're being redeployed and whatnot. But there are a lot of docs who are just sitting back and waiting, kind of with nothing to do or waiting for their patients to talk to them again, or waiting to be able to take care of their patients, I should say. There are also things like blood draws that you can get taken care of at home if you need to. And, I would not be surprised if your doctor kind of screens you prior to your visit for signs and symptoms of COVID, just to make sure also, your docs want you to be safe and they want, their other patients to be safe too. So I think there's a lot of things happening there. What else? We have a question from the audience.
Randy, can I just say can I mention one thing?
Absolutely.
Related to lab draws? Northwell has a new lab drawing at-home service called LabFly. I'm not sure if you mentioned this, but LabFly is a very convenient app on your phone where you can schedule, and I do this with my kids. It's extremely easy, and you do pay a $19.99 fee for lab draws at home, but it's you get your labs back right away. So anyone who needs their labs drawn should use LabFly, and I think, Flora, you can post that to the group chat if you need.
John, is that in Manhattan only, or is that?
No, it's actually all over. It started in Long Island, and it's all over Long Island, Manhattan, and now in Westchester.
That's fabulous.
It's called LabFly. I do it for all my kids whenever we need blood, and they do anything. You basically, what you have to do is the patient needs to have a prescription, like a picture of a prescription.
Right.
So that's the only thing that is. So I'm not quite sure sometimes how that works in this day and age, how you would get them. But basically what I do is I write the prescription and you can text them or send them the picture, and then they upload the picture into the app.
Yeah, it makes things easy. It's great.
So
that's fabulous.
Yeah, it's easy to do.
What about telemedicine? Dr. Teckie, Dr. Gruber, are you guys set up for telemedicine at this point? Has it incorporated itself into your life?
So I've been doing it now for 2 weeks. I was a little bit anxious about how it was going to be, but it's worked out much better than I anticipated. First of all, it's kind of fun when you see patients that you know well in their familiar environment. But you can tell a lot just from talking to someone and observing them. While you can't do a hands-on exam, you can certainly have them do things that will bring out things that you might be concerned about. Mm-hmm. And find it's very, very useful.
Great.
And not so difficult, not difficult.
Yeah. Dr. Teckie?
Yeah, I love it. And I think our patients really like it. So I think it's here to stay.
We've incorporated it, you know, full-fledged. At the end, we'll have a link to kind of the websites for, you know, everyone that we can. But it's become, you know, part of our life. It's very easy to do. Patients can stay in the safety of their own home. They're just, you know, it's like FaceTiming with your grandma or grandpa or mother or father or children. And at the same time, you can make recommendations about things, and you can look at images and review and be there to support people. So I think very, very valuable, and definitely something that, you know, if people are hesitant to trying, that they should consider strongly as patients. One other question that I keep getting is, you know, people want to know, should they get out of town until this is over? How do you guys respond to that?
Well, where are you going?
On a cruise.
Right? I mean, I don't know. I mean, if people will say, like, can I fly somewhere? That seems a little risky, right?
Yeah.
You want to be near your doctors in case there's an issue. I don't think I have a great answer. I mean, maybe if you had a large second house that wasn't so far,
Yeah.
that wouldn't be unreasonable. But this virus is going all over. So I think kind of being home is really probably the safe thing. But I'm curious what other people are saying, because people have asked me this before.
Yeah, Dr.
What do you guys think?
What do you think?
Yeah, I've actually been asked this a lot by our friends, not necessarily patients, but my thinking is kind of like, well, what's your long-term plan? Because yeah, maybe you can get out of town for a couple weeks, but when do you plan to come back, and what do you think is going to happen when you come back? I'm not sure the virus is going to completely disappear in a few weeks. I think it'll still be around, so you have to really think about how are we going to live with it, as opposed to like how are you going to flee from it. And I think maybe in the short term it kind of makes sense to get out of town because the kids aren't in school and there's not much happening, but you know, eventually we're all going to have to get back into our lives and kind of live with it. So I think long term it doesn't really make sense to leave town, but maybe short term to just kind of get away while it's at its peak. I think that's okay if that's something you can manage, but I wouldn't go out of my way to do that.
Yeah, I think ultimately I find it to be a personal question. It's kind of a little bit of both. You know, what's your reason for leaving? Why are you going? And where are you going? You know, I think that at least for our community, which is the group of patients we're trying to reach out to, this is New York City, and within a 14 by 2 mile radius, you've got 5 major academic medical centers, which sure are, you know, feeling a surge right now, but you're getting great medicine at any of these places. And not only that, if you're a patient suffering from, you know, a brain or spinal cord tumor, your own doctors are nearby, and you don't necessarily want to be caught, you know, sick in a place where people don't know you. And so I'm, you know, I'm pretty in love with New York City, and I don't think I would recommend anyone leave in the middle of a crisis, but you know, it really comes down to what your reasons for leaving are. So, yeah. I mean, I wanted to keep these sort of short meetings. We got a couple minutes left. We got another question from the group. Jacob is asking if internships are on hold for the summer. Not sure how much that has to do with brain and spinal cord tumors, but I think for the foreseeable future, things are on hold. I'm sure that there's going to be plenty of research to do afterwards, and we'll get people in as quickly as possible once we're done.
It's funny.
What other questions do you guys hear? Do you hear a lot from patients? Anything else?
I hear a lot of people asking if they should take the subway or not.
Yeah. What do you tell them?
Again, I think it kind of comes down to like, what's the long-term plan?
Yeah.
I think right now, if you have to take the subway to get to work or to get to a doctor's appointment, you do it with all those, you know, precautions in mind, with the mask and wearing gloves and distancing and making sure everything you touch is cleaned or disinfected, or try not to touch anything. But I do think like long-term, eventually we're all going to have to take the subway. So
yeah, I think,
I don't know.
The one issue is that, you know, often brain tumor patients, especially brain tumor patients, they're a unique group, which may have difficulties that other oncologic patients don't have, whether it be cognitive difficulties or movement difficulties. And so, you have to kind of think about that when you're guiding these people in terms of how they're going to get places and go places and how to be safe. And so, from a subway riding question, I mean, it comes down, it's a personal thing also. I think I agree with you. If you can be safe and take the subway, be safe and take the subway. Wash your hands and wear a mask and do that. But if it's a patient who, relies on someone else or isn't really capable of making their own decisions properly, or, struggling with some stuff, have a family member help out, or ask a family member or a caregiver, someone to help you get through it.
Yeah.
So I guess in the last couple minutes, the last thing I wanted to touch on was, the stress and kind of psychosocial kind of influence of this whole thing. Obviously people are stressed, people are uncertain, there's a lot of anxiety, a lot of resources to this. And I would advocate also that patients get in touch with their docs to find out who they can talk to. I know at Lenox, we have a clinical neuropsychologist who does a lot of work with this. And I'll post her info. I'm going to try to get her as a guest next week also. Her name is Brittany Lamonda. And she's been heavily involved with kind of recommendations for patients going through this. What do you guys tell your patients in terms of dealing with?
We also have so in Long Island, we have a social worker twice a week, but really available much more than that, named Nancy. Mm-hmm. And then I know in radiation, there's a Corey over at Lenox, and they can be really helpful in terms of trying to figure out the practical things like transportation and they can do some speaking to the patient. But if somebody feels that they're struggling with something that's more than just a little bit of stress, they can make the appropriate referral. And now there's a lot of telemedicine psychiatry, which is nice. It's kind of opened up and become more available to more people, I think. There's a time when it's not, people should not feel shy to ask for support. People without brain tumors are having a lot of struggles with what's going on. So people would understand that this is just that much more, and we really want to help you holistically.
Yeah, absolutely. So we'll try to get the social workers on also. You think they'd be willing to come and talk?
Yeah, I do.
Yeah, I think that'd be very valuable. Great. And then, I think, we can take more questions. We're going to post a link to a survey kind of questionnaire thing where you guys can post questions that we can answer next week as well. And just, tell people to come on. We'll have more and more information. Again, these are diseases. COVID-19 is not the only disease in the world right now, although your television might suggest otherwise.
Right.
And, we're here to kind of make sure patients know, the community knows that we're still available to take care of these situations, these issues. We actually just, Dr. Bookvar and I just published kind of guidelines or recommendations anyway for the neurosurgery community in terms of taking care of or triaging brain tumor patients. That'll be out in, Journal of Neurosurgery or the journal called Neurosurgery in the coming weeks. But the bottom line is that, these are real issues that need to be taken care of. And so it's good to know, I think, that radiation oncology, or neuro-oncology are still doing their jobs as well and taking care of patients and there for people. So I thank you guys for coming along. Please tell your patients, and we'll try to get more and more people and spread the word.
Yeah, so if you would let me know what the link is, I can definitely let our patients know, because I bet you some of them would love to join.
Perfect.
It'll be the same link for next week as well, with the same meeting ID code to keep it simple. So you could just share the exact one that I sent you.
Perfect.
All right.
Thank you.
All right. Thanks.
All right, everybody have a safe and healthy week.
Yes.
Yes. Be well, everyone.
Thanks so much.
Bye.
Thank
Bye-bye.
Thank you. Thanks for arranging this.
Yeah.
Bye.
Bye-bye.